Hello, welcome to ANA community. In this particular video, we are going to discuss some of the important aspects of a hospital. Whenever a person or student who are going to enter the hospital, whatever may be that, whether is it Ayurveda hospital or Western hospital, etc., what are the uh, essentials that has to be followed? What we can say that is ward ethics. We are going to discuss today. Whenever we are going to say about the ward ethics, so ethics actually is considered to be the discipline which is concerned with knowing what is morally good or morally bad, and what is morally right and what is morally wrong. This particular term, ethics, can be applied to any system or theory of a moral values or principles. Why this particular ethics that will matter? Because it is a part of how many groups define themselves and thus part of identity of their individual members. So that means whenever if you are looking into that, let it be the doctors or let it be the lawyers, etc., there are certain aspects that will be followed by those communities regarding what is right and what is wrong and what is good and what is bad. And this is actually helpful in developing the or in having a good rapport and mutual respect and trust may be developed if the ethics are being followed properly. And when you think about the ward ethics, so this is nothing but the principles they are being followed whenever a student or a medical professional is at the inpatient ward or inpatient department or inpatient ward or in the hospital. So here we are going to see about what is considered to be morally good and morally bad and what is morally right and morally wrong. The main areas where this particular medical ethics that is actually concentrating upon, that is four areas, that is beneficence, non-maleficence, autonomy and justice. Beneficence in the sense doing good, always good to the patient itself. For example, if the person is having the pain abdomen, severe pain abdomen, so and he is having the uh, passing the diarrhea, the ideally the doing good will be, if you look into that, as far as the Ayurveda practitioner is concerned, you need to know about whether it is having the samatva or niramatva. If the person is having the samatva, then we are going to ensure that this particular samatva is completely eliminated. When the person is having the niramatva, then we are going to give the medicine specifically related to sangrahi dravya. This is what we can consider there. And when the person is suffering from the burning sensation in the gastrium, the ideally the doing good will be, first of all, the Nidana Parivartan has to be done, then Pitta Shamaka medicine has to be given. So this is, we are always thinking about the benefit for the patient as such whenever if you think about this particular angle. And non-maleficence, that means doing no harm. Suppose if the person is suffering from diarrhea and you are going to give the Stambhana medicine at that particular time period, this is actually responsible for the inflammation to happen in the large intestine. Thereby, this particular pathogen, they are going to enter into the capillaries of the large intestine. From there, that will be entering into the bloodstream. intravascular compartment. That means there will be a possibility of the having a much harm in that particular regard. Autonomy to the patient. That means freedom to the patient. If the person is suffering from the diarrhea, the same example let me give you. In that particular situation, let him decide to whether to take the Ayurveda medicine or whether to take the Western medicine. Or you have to give the freedom to know about the whether the properly understanding whether the person is having samatva or niramatva, that has to be properly educated to the patient. Then you have to give the advices or treatment as such, and justice as such, ensuring the fairness. That means there should not be any kind of the uh, what do you say the uh, any uh, benefit to one particular uh, side. That should be ensured. And regarding the ward ethics, so that means we need to know about how to visit the patient how to visit the hospital. That means how we are going to enter the hospital. What are the things that are required before entering the hospital? When you are starting interacting with the patient, how to have your behavior, how you are going to interact with the patient, what will be your sentences initially, whether you are going to interact with the patient directly with the presenting complaint or not, or you would like to have the development of a good rapport as such. That has to be ensured there. Regarding your combing the hairs as such, are you having the properly combed hair, properly the washed clothes as such? That has to be ensured. When you are going to starting the physical examination, you are going to you are going to take the proper consent of the patient, whether is it informed consent or written consent, that has to be known. And having a chaperone means either the female staff nurse or the family member, specifically when you are doing to do the examination of a female patient, specifically if you are a male physician or male doctor. And after doing the physical examination, what kind of the laboratory investigation would you like to suggest? And after having this particular interpretation of the results of the laboratory, communicating the same outcomes to the patient, how we are going to inform the patient, whether is it life threatening, as how we are going to inform the patient, so that the person will not feel much discomfort or much kind of what you say that he should not be feeling low while having the listening the laboratory interpretations as such. Further, to decide the exact plan of treatment as such, considering sole benefit of the patient has to be ensured, and this one will be helpful in entering the field of research as such. Last 2 points, they are not having the much importance at this particular juncture. We are not going to cover those 2 points in this particular slide and in this particular session. When you think about the entering the hospital, here there are 3 different examples. So one, as such, the person is taking the book, having a stethoscope in his neck, having the apron, well dressed individual, properly combed hair. This is the scenario. In the second situation, see, the person is actually having of course he is also well dressed, but look at his attire. So having wearing the sherwani, etc. Whereas third aspect, see this attire looking like the tonsured head with specific t-shirt as such. Look into this three categories of the images. Which one will be ideal when you are going to the hospital? Naturally, extreme left image having the stethoscope or apron, etc. Whereas the middle one image specifically, that is specifically indicating that the person is entering into the marriage hall. Specifically, he is a bridegroom. Whereas in the third image, that is not giving any kind of the positive images as far as the patient doctor interaction are concerned. So the whenever if you are having an interaction with the patient, ideally you are going to have the first and foremost criteria is to develop the very good rapport with the patient, so that we are going to get the right information at the right time, so that will help in making the right diagnosis, so that right kind of treatment is possible. Regarding the tools, when you are coming to the hospital, of course, much tools as such, for example, tuning fork or the blood pressure, sphygmomanometer, etc., they are essential. But four things that are essentially should be present whenever if you are entering into the hospital. First and foremost thing, that is stethoscope. So in the olden days, the clinician used to keep his ears on the chest of the individual to know about the exact what kind of the abnormal sounds are being heard on the chest. But nowadays, this is being avoided. Better use the stethoscope so that you can hear the sounds from the faraway distance itself. Regarding the respiratory sounds, regarding the cardiac sounds, regarding the peristaltic sounds, regarding the fetal heart sounds, etc. So for to know about the exact the physiological parameters as well as pathological parameters, we are going to use the stethoscope. The next one, that is tendon hammer. Specifically in the neurological examination, to analyze the reflexes, maybe the deep tendon reflexes, maybe superficial tendon reflexes. This is used in this particular occasion. The third aspect, that is the measuring tape, specifically to know about the anthropometric measurements. For example, the swelling of the knee joint, or if the person is having the abdominal enlargement, to know about the enlargement of the abdomen, regarding how much the size of the abdomen is going to get increased. Plus, so to know, check the progress of the what do you say, that the abdominal swelling treatment. And the fourth thing, that is the pen torch, specifically to look into the mouth, regarding the internal structures of the inner structures of the mouth. For example, tongue, to know about the pallor or icterus, or any kind of the ulcers are being present. To know about the teeth, any kind of the dental caries are being present or not, or is there any gums, bleeding gums is being present or not. And oral cavity mucosa, is there any the fungal infection is being present or not, tonsil enlargement is being present or not, or regarding the uvula, specifically in cases of the vagus nerve examination, etc. Whenever if you're looking into that, pen torch is essential. If you are going to do the examination of the nose, to knowing about the redness of the nasal mucosa, to know about the hypertrophy of inferior nasal turbinate, to know about the deviated nasal septum, to know about the presence of crust in the nasal cavity. So torch is essential. In cases of the eyes, to know about the accommodation reflexes, to know about the what do you say that the to know about the abnormalities specifically in relation to the redness as such, nearly medial canthus. This is essential. In cases of the ear examination, to know about the uh, wax, presence of wax in the external auditory canal, to know about the rupture of the tympanic membrane, etc. The torch is essential. So like that, plus in case of the hydrocele examination, so this pen torch is specifically used. So like that, whenever if you look into this, four essential tools are necessary: stethoscope, tendon hammer, measuring tape, and pen torch. These are essentially required by the medical student or Ayurveda student who are visiting to the hospital. And while interacting with the patient, extreme right image is considered to be the right approach. So right image, no, extreme left image, it is considered to be the ideally positioning or ideally interaction with the patient. Whereas extreme right image, that actually reduces the, or do you say that the proper, what do you say that the respect and interest and the trust with the clinician. If the extreme right image is being followed whenever if you are interacting with the patient in the hospitals. And while doing the physical examination, so specifically you need to say what you are going to do. That has to be properly informed to the patient. For example, if the person is a child, you need to give the, what do you say that the, you need to uh, take the confidence of the child. So ideally, the child will be comfortable when he is or she is with her guardian, specifically the mother. So make the child to sit in the lap of the mother, then do the examination. So here the region-wise examination is being preferred rather than systemic examination. Region-wise examination in the sense, if you are going to do the examination of the head and neck, whatever the examination related to head and neck are essential, do that first. Then go to the chest examination. Whatever the parts to be examined in the chest, whether it is lungs or heart, etc., do that examination simultaneously. This is what we can say region-wise examination. Whereas if the patient is of the teenage or adult age, then we are going to do the system-wise examination rather than region-wise examination. Make sure that the patient should have minimum discomfort. So if the person is having the pain abdomen, so minimum discomfort may be possible if you are what do you say that doing the examination, if you are draping the other parts, covering the other parts, only exposing the abdomen properly. So this may produce the minimum discomfort to the patient itself. And specifically, if you are going to do the examination of the female patient, and if you are a male as such, then the chaperone, what we can say, should be present. The term chaperone refers to the female staff nurse or any family member of the female patient. In the presence of them only, him or her only, you are going to do the examination of the female patient. this one has to be properly followed. And while planning the laboratory investigation, appropriate laboratory investigation should be preferred. For example, if the person is having yellowish discoloration of the skin or sclera, that is indicative that the person is suffering from hepatobiliary dysfunction. Now, to confirm that particular the hepatobiliary dysfunction, the ideal laboratory investigation suggested will be liver function test. And if the person is having the burning micturition, let us take the another example. In that particular situation, the ideal laboratory investigation preferred will be routine urine analysis. In that, probably we are going to get the increased pus cells in the urine in the case of microscopic examination. So this is how, so we are going to follow this. And interaction with the patient after the laboratory investigation. That means you are going to interact with the patient to give the appropriate interpretation of the result. For example, if you are getting the total leukocyte count more than 11,000 cells per cubic millimeter, this may suggest inflammatory or infective condition of the patient. The same can be informed to the patient itself. And if you are going to analyze the prostate specific antigen or PSA in the blood, and if it is more than 4 nanogram per ml, it is indicative of the person may be suffering from benign prostatic hyperplasia or prostatic cancer. So these are the things that has to be followed whenever if you are entering into the wards as such. The take-home messages from today's discussion are: ethics are nothing but the codes of conduct which suggest that what is morally good and morally bad, or what is morally right and morally wrong. Whereas ward ethics refers to the codes of conduct followed by the medical professional in the hospital. Core areas of the ethics are beneficence, non-maleficence, autonomy, and justice. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners or true Nidana learners so that we can make a huge movement of this particular small message. That's all for today. Something more in the next video. Thank you.